put your hands together for Dr. Sukhbinder Singh Sibia, ladies and gentlemen. Sir is going to talk about Heart Smart Secrets.
Good morning, everybody. It's a pleasure to be here again. Thanks, Sanjay. I'm seeing very important figures, people who are here who have really changed the way people think. They are people who have impacted thousands of lives. So, we are here with some heart smart secrets, and all non-invasively. When we talk of non-invasive, a lot of things come in our mind. First of all, let me tell you how I got into this. There was a patient in 1993 who had a stent. The recurrence after stent just within 2-3 months. He was told another angiography and possibly bypass will be required. It is those days when stent, angiography, angioplasty were not available in Punjab. So it was in the leading center in Delhi. Since within 3 months he had a recurrence, he was well known to me. I was the person who sent him for stent to Delhi. And I felt very bad that patient I had sent, he's lost all his life savings. He's taken loan. And after 3 months, he is back to zero. So that is what set me on this line, because he said, I cannot afford another bypass. I have not even repaid the previous loans. So do whatever is possible. At the same time, another friend of mine who was a director in the health services, his mother had a problem. So he brought some literature to me. I went through that, and I found that there's something interesting. Of course, my first reaction was, all rubbish. I cannot believe it. But when I went deeper into it, I realized that it made sense. I got in touch with around 400-500 doctors around the world. I sent faxes to them to understand it better. And that is how I got into chelation therapy. And then one thing led to another, and we kept on progressing. That patient of 94, my first patient, is still alive, and he's in USA and doing very well. So this is the power of chelation therapy. And I'm not surprised when people say it is bullshit, because I myself have crossed that state where I myself felt that it makes no sense. But once you go deeper into things, you realize that everything makes sense. There's something known as non-linear thinking. I'll just, when I asked Dr. Raja Vijay Kumar, who's the inventor of cytotron and CCGN, he should have been the Nobel Prize winner. I asked him, what is non-linear? So he said, a butterfly in Tokyo, she flutters her wings, and you calculate what is the speed of wind and what is the weather in New York. So everything is related with each other. It is only that we are not able to find out what. And as soon as you find out why it happens, a lot of things which were at one time unscientifically, we call them scientific. So there's a very fine line between something being scientific and something being declared unscientific, something which is being declared as useless. It is just a thin line of, are we able to explain it or no? So never keep your eyes closed, because what we think today is useless, unscientific. Tomorrow it may be scientific. At one time, the earth was flat, and anyone who said it is round was an uneducated fellow. And today we are saying anyone who says that the earth is flat, he deserves to be in the mental asylum. At one time, a person who said that I'll fly like a bird, people would not believe him. Today, a person who has not heard about an aeroplane, he is a tribal who lives in the jungles who never met anyone. So it is progress, and I see that non-invasive cardiology is in that field. We are all moving away from surgery to stent to non-invasively. And this is why I'm standing here. And what is the importance? It's a wake-up call for everyone. Half the people who have a heart attack, they land up in the ICU and they never knew they had a heart problem. And the other half, they knew they had a heart problem, and they did not do enough to avoid the consequences. So let us not be in half who never knew that they had a heart problem. First of all, let us become a bit interactive. First of all, let's find out who's at risk of a heart disease. How many of you are under 40 years? Can you please raise your hands? How many of you do not have high blood pressure or diabetes? Please raise your hands. I'm saying too few hands raised. That shows what our health is like. How many of you have high cholesterol or triglyceride? And how many of you are overweight? Just assess yourself. How many of you do not have anyone in the family, father, mother, grandfather, grandmother, your brother, sister, who has never had a heart problem? And in this now, I will also add your children. Because let's move aside from genetics, aside from hereditary, towards familial. Because if a family has a certain habit, although it may not be in the genetics, we'll all be affected in the family. So the whole family needs to be healthy. Only then we can say that there's health in the family. How many of you are doing regular physical activity? Again, I'm saying less than 50%. How many of you are really sleeping properly? That means sleeping when it is time for darkness, according to the circadian rhythm, as Dr. Sanjay has put it. How many of you are sleeping when the sun goes down and awaking when the sun comes up and sleeping in complete darkness? How many of you are doing that? I think I can just around 5. I don't even need the fingers of my second hand to count that. How many of you can say you don't have stress consciously or subconsciously? Of course, subconsciously is difficult. Only 1 or 2 hands. How many of you have never used tobacco and never had excess of alcohol? Good. And now the final question in this series. How many of you can say that you don't have any of these at all? Anyone? So everyone sitting over here is at risk of a heart disease because no one raised their hands. So that is where our health is. We are all at risk, so we all need to do something about it. And the second part, do you have really now, has very little significance because we all are at risk. Pain, discomfort, heaviness, tightness, it can be in the chest, it can be in the back, it can be shoulders, it can be in the arms, jaws, upper abdomen. Upper abdomen is often missed. A lot of times when we are thinking that it is acidity, may actually be a heart problem. Breathlessness, irregular heartbeat, decreasing memory. Because when you have a blockage, it will never be in the heart alone. It will be in other parts of the body also. It will affect your brain, it will affect your legs, it will affect your sexual activity. It will be overall, you'll have the problem. If you answer yes to even one of them, I think you're required to take action. And you're required to take immediate action. Anyone who has none of these should be very happy about it. Now, how do we confirm? They're all basic tests. I won't go too deep into that. Blood, urine, ECG, echo, cardiovascular cartography. That's a wonderful test. No one wants to go in for invasive, so I won't discuss about angiography. Stress thallium is non-invasive, but it has radiation. So I personally feel that they all have their importance. I don't say there's any single test which does not have importance. They are all important, but I personally will lay stress on cardiovascular cartography. If required, then the other tests. It is non-invasively invasive, no injection, no wires, safe, comfortable, no radiation, and just around 20 minutes from start to end. The actual test is only 256 heartbeats, less than 5 minutes, and comfortable. It gives a lot of information. It gives around 50 parameters. But the two which are most important are blood flow, not blockage. I'm talking about blood flow. And myocardial oxygen demand and reserve. Other than that, it is telling us the load on the heart, whether the load is due to ischemia, is it due to blood pressure, it is due to fluid overload, the sympathetic, parasympathetic overactivity. We have seen that patients who have sympathetic overactivity, whatever we do, stent, bypass, treatments I do, they all are useless. So it is very important to take care of the sympathetic overactivity. Now, this is a very important thing that we are seeing every day. Patient walks in, he brings the angiography report. The angiogram says 90 to 100% blockage, never had any angina, no problem. He just had his CT angio done because someone else had motivated him into it. So many patients who have normal coronary arteries and they are having angina. Where have we gone wrong? This is very, very important because something is wrong somewhere. Patients with 99-100% block, no angina. Patients with normal coronary arteries, having angina, having heart attack. So this is what is important. It is important to understand that blockage is not important. Blockages do not cause heart attack. It is the blood flow diminished which causes heart attack. And there can be many reasons for that other than blockage. So, and if you have blockages, even 99% or 100% in some, if you have got enough collaterals to compensate for them, you require no treatment, even with 100% coronaries blocked. So this is where we have gone wrong. We are measuring blockages and going ahead with the treatment instead of finding out how much of those blockages are effective and how much God, nature, has already taken care of by creating the collaterals. If nature has treated you, why should you go ahead with anything else? Man cannot create a better bypass than the bypass created by nature through collaterals. Collaterals are also bypass. They are nature's way of doing the bypass. Problem is that when we do angiography, we are only able to see the large blood vessels. You are seeing so many small blood vessels this side, the collaterals and all, which are not visible on angiography. So when we think of angiography, when we base our treatment on angiography, in angiography you are seeing blocks. When you see blockages, you want to treat the blockages. When you want to treat the blockages, you have angioplasty, stent, and bypass. And when you think of blood flow, then you have other options, like your ECP, ESMR, your articulation therapy. So these are how the mind thinks. When the mind thinks of blockages, the first thing which comes to your mind is stent and bypass. And when your mind thinks of blood flow, they don't think about stent and bypass. You think of how to increase the blood flow. It can be due to your lifestyle. It can be due to your ECP, chelation therapy, ACT. Just by the way, we are doing chelation therapy since 1994. And this word ACT, artery, initially we called it artery clearance therapy. Then we thought that it's not really clearance, so we call it artery chelation therapy. This word ACT was actually coined by us in Sibia Medical Center. And I never realized when one day in the Tribune there was a quiz that what is the meaning of ACT. And it was artery clearance therapy developed by Dr. Sibia. It was really a surprise when I saw that. So let us think about blockages. When you think of blockages, we want to measure blockages. When you want to measure blockages, you have stress thallium or your cardiovascular cartography. I prefer cardiovascular cartography because it's non-invasive, gives much more information. I do not deny that stress thallium is better known to most doctors. And then comes the treatment part. You have two directions, surgical, non-surgical. In surgical, you have angioplasty, stent, bypass. In non-surgical, you have ECP, ESMR, and articulation therapy. Now, for some patients, the option is there for stent, bypass, or your non-surgical. But there are a lot of patients who only stent or bypass should be done. That is left main coronary artery disease. Patients who are in acute state, like the non-surgical, non-invasive treatments are slow acting. Some patients who require immediate treatment, for them, primary angioplasty and bypass are of choice. The others should not be there. Now, that is only a small fraction of the patients. If you go through ischemia study, it even says that in the long run, there's no difference between the invasive treatments and medical side. In external counterpulsation, it is a US FDA approved. When I say that, I mean some of the machines are US FDA approved. In India, why should we bother about FDA? Why should we accept the dominance of another country over our own country? Why should I bother about FDA if I have an equally good machine? You may have a better ECP machine. Does it really require a label of FDA? It is unfortunate that when a label comes, when a thing is stamped with FDA, we tend to believe it more. But a non-FDA may be equally good. But what I mean to say is that this process of ECP treatment is approved by US FDA. Cuffs are wrapped around the legs, and if you have a ECP machine which also have the arm cuffs, it is around 15% more efficient. Most machines don't have that. Ours does. It's a 35 one-hour-day process. It can be done once or twice a day. It can be done 5 to 7 days a week. And the main purpose is to increase the collaterals. It also has effect on the nitric oxide, on the hormones, and a lot of other things. The small blood vessels are dilated. The dormant blood vessels, which are there since birth, they open up, and there's stimulus for formation of new blood vessels. And it improves the circulation through almost the whole body. The heart, the brain, the kidney, the leg, the sex organs, everywhere. So I'll say it is an overall rejuvenating treatment. We have even seen patients' hearing improve. We have seen patients, pure white beard, having streaks of black hair. So this is how effective it is. And of course, you can, as I showed you, it is mentioned in the textbooks. I'm doing nothing which is not mentioned in textbooks or journals. Then we have ESMR. This is the latest weapon in non-invasive cardiology. It's a German technology. Only 2 companies in the world are making it. We introduced it in 2019. That's the first center in North India. In South India, there were 2 or 3 other centers. It is painless. We focus ultrasonic waves on the myocardium to stimulate formation of new blood vessels. This ESMR, the same technology, extracorporeal shock wave, we are using since 1991 for kidney stones. It is also used in ortho. It's also used for ED and a lot of others. Of course, for each application, the machine, the intensity, the frequency, they all vary. So it is 9 sessions, about half an hour each session, and with wonderful results. We see the EF improving, the circulation improving, patients, because there's also vasodilatation, patients may feel the improvement in the very first sitting. All of the treatments, I personally feel, they should be very effective when a patient is having MI also. But since I don't have an ICU set up, I will not go ahead with it. But I think that they should be equally effective. Then articulation therapy, we are using the American College for Advancement in Cardiology, their protocol we are using with some modifications to suit the Indian public. Intravenous drip is given. It is again mentioned by Linus Pauling, the only person who's won 2 Nobel Prizes and in the same field. It's mentioned in the Journal of Advancement in Medicine. It is mentioned in the Journal for American College of Cardiology. And these treatments, they are not limited to the heart. They have got multiple roles. In the heart, of course, it is there. It improves the blood pressure. Peripheral artery disease, leg pain, intermittent claudication, it is helpful in that. It enhances sports activity. In fact, one person in California, I received his email that he's a sportsman. He's kept a ECV machine in his house, and he wants to sell that. So some sports people may be keeping in their house for their personal use also. Then tiredness all the time, chronic fatigue, sexual problems. Now we have started doing it for Parkinson's disease. We have not done too many cases. We have just done around 2-3 patients. And they're feeling better. One patient who had come from Delhi, she said she is 40% better. For a treatment which has got no specific treatment at all, I think even 40% is very good. The reports from China are that it is equally good as the medicines, and some patients even stop the medicine. We'll wait till we claim such a thing. Health does not depend on medicines alone. Don't fear the doctor. He is there to make you aware. I mean, this is very important. You should be aware of your disease. You should be aware of the treatment options, their benefits and their limitations and their side effects. Whenever you go to a doctor, and the doctor sitting here, it is our duty to tell the patient these things, and it is also our duty to tell the patient of other options available. I always start by telling a patient that you have a heart disease. You have got 2 types of options, invasive, surgical, and non-invasive, non-surgical. One side you have the stent and bypass, other side you have these. I always make it a point that patients should know what treatments are available, even if I'm not offering them. That is very, very important. And nutrition, toxins, lifestyle. We have been talking a lot about lifestyle. One very important thing, don't take stress of lifestyle. That means if you want to go in for lifestyle, excellent. But don't take a stress for it, because that stress may be worse than improving the lifestyle. Everything you're doing to improve your lifestyle may be zero if you take stress about it. I'll just sum up this part. There was a Helsinki study, over 20,000 patients, lasted a number of years. One set of patients, for blood pressure, one set of patients, when he went to the doctor, they were told that take these medicines and go back. The other set of patients were told, take these medicines, do exercise, take this diet, do this, don't do that. In the end of the study, the patients who were told to do lifestyle management along with the medicine had double the amount of cardiac events as compared to patients who are not told about lifestyle. So it's a very amazing thing. There's an editorial in IMA journal in around 2000. I still have kept that copy. So there's something wrong in our whole thing. And I personally feel lifestyle is good. The thing which was wrong was every time a patient went to the doctor, he insisted on lifestyle management, which itself became stress. And the stress part was doing the harm. So every year, do have a heart checkup, annual checkup. It'll do you more good than having your car serviced. And living in air, water, food, pollution-free, if your mind pollution-free is good. But along with that, if you fall in the first group, risk, or in the second where you have a problem, then consider improving your circulation with these treatments. Thank you. Wish you a healthy heart and a good quantity and quality of life. Thank you.
Thank you so much, sir. Thank you so much.
Thank you.